Some years ago, when my parents used to go to the doctors on their own, they'd come home and I'd say, "Well, what did he say?" "Well, everything's okay." Well, the way they looked and moved and stuff, it was pretty impossible for everything to be okay. Or they get a new medication and they say, "Well, what was this really for? I'm not sure." So I decided that it was important to start advocating for my parents with their family physician, who was wonderful and a good friend of the family, but he's got his own agenda and all his work he's got to do. So I started going to appointments with them and listening and asking questions. And I actually learned that for the best medical appointments, it was important to be prepared, to get ourselves organized so that when we got there, I actually had a list of questions for each one of them to say, this is what some of my mother's issues are, this is what some of my father's issues are. Because the reality is that when you're getting advanced in your years, by the time they call your name in the waiting room and you get into that little cubicle, you've used half your allotted time anyway. So I started simply gathering them up and moving them better and being prepared with and for them and asking the questions. And when there's a medication, asking what it was for and why and how did it interact with other medications. And what I think we established over time was better quality doctor's appointments. Overall, I think their family physician had a better experience as well because he didn't have to explain several times. And I think that I was able to advocate more effectively for my parents so that their needs, medical needs, were more fully met, and we got a better balanced picture of the condition of each one of them and why things were being done and how. And another matter was, I think that oftentimes I found that my parents were reluctant to ask certain things because they didn't want to bother the doctor or they didn't know how to deal with it. Whereas I had no shyness when it came to saying, well, wait a minute, what about this, or can we check for that? So all in all, the real lesson for me always has been, to this day, to advocate for our parents with their family physicians, with specialists, with any physicians, with anywhere in the health system. Leaving them alone makes them, I think, more vulnerable and sometimes getting less of the kind of attention and detail that really we want to have.